In our society today, substance use and homelessness often go hand in hand, and because of the hopelessness that individuals feel, it can lead to feeling suicidal. In our society, there's a lack of resources for anybody to believe in and to provide hope for people with substance use and homelessness. And because of this, it leads to suicide. The World Health Organization says that suicide is a significant global public health concern. They estimate that over 700,000 people die by suicide each year, with more deaths attributed to suicide than malaria, HIV/AIDS, breast cancer, or war and homicide. As social work, we can do our part at looking into substance use, homelessness, and the co-occurrence of that leads to suicidality. I think the work we can do with that would not only lower suicide rates, but help reduce both homelessness and substance use. Compared to the general population, suicidal ideation, suicide attempts, and suicide-induced deaths are higher among homeless individuals. These individuals are members of our family and friends. Addiction really radiates negatively through all of our society. This study will look at the ultimate need for more resources in the community and bring some individuals with lived experience to the table to discuss some real life solutions. This topic is extremely important to examine because people's lives are at stake. The research says that life expectancy for unhoused individuals is 20 years lower than the general population, and one of the largest contributors to this increased mortality is suicide. There's a high number of substance use disorder and a fentanyl crisis going on, and the purpose of this paper is going to look at how addiction and homelessness tie together and lead to suicide. Addiction and homelessness don't discriminate, and it can happen to anybody. The research study I did is unique because it will address not only the correlation between substance use and homelessness and suicide, but will determine if the co-occurrence leads to a higher risk of suicidality, whereas a lot of the studies have just looked at either homelessness or substance use, so this will tie that together, and it'll address whether a higher rate of suicidality for individuals who use substances and experience homeless is higher than those who do not. And by determining that, we can come together as social workers to better address this situation and get the individuals connected to resources to help them. So for my literature review, I looked at what is the relationship between substance use and suicidality among homeless individuals and asked if their co-occurrence increased the risk of suicide. I believe the research will find that homeless individuals who use substances will have a higher probability of suicidal feelings than those who do not, and that the co-occurrence of substance use and homelessness will further increase the risk of suicidal ideation. And after doing the research and the studies, many address substance use and homelessness and suicide, but didn't look at those all together. I believe that individuals with higher ACE scores also lead to an increased risk of substance use and mental health diagnosis per my research. And when an individual develops a substance use disorder, it can easily lead to mental health systems and homelessness. Once they're in that dark hole, it can feel impossible to make it out of, and hopelessness sets in. In a 12-month-long study completed with 455 current or former homeless individuals in Quebec, Canada, they found that suicidal ideation was higher among individuals who had been diagnosed with generalized anxiety disorders and substance use disorders, and the suicide attempt rate was even higher than the ideation. The study recruited participants from 27 agencies, determined that homeless individuals completed suicide 10 times more than the general population, and a limitation of that study was that the individuals self-reported and didn't use any medical documentation. Another study agreed with the findings, saying the highest suicidality rate was linked to substance use disorder and anxiety, and to help with that, would be improved access to case managers to assist with screenings for mental health and substance use, and to implement treatment center services in homeless shelters. The Colorado Symptom Index was used in a longitudinal study of suicidal ideation of the homeless in 2015. That questionnaire is comprised of 14 questions and a scale rating of not at all to at least every day, in which the individual rates themselves on feelings they've been experiencing within the past month, and the higher the score, the more distressed they are. In particular, they noted question 13 that asks, in the past month, how often did you feel like hurting or killing yourself? The participants completed that survey at baseline, 6 months, 12 months, and 24 months. The results determined that depressed mood had the strongest association, followed by polysubstance use, use of any substance, intravenous drug use, recent arrests, and daily substance use, which is just another confirmation that individuals with substance use and homelessness are at a greater risk for suicidality. As published in the Journal of Public Health, they studied over 12,000 references electronically while researching more on the topic of substance use disorder and suicide. They concluded substance use disorder is associated with suicide risk increase, but also noted there is quite a bit of heterogeneity in the studies. The difference in this study from the others is that it was done as a meta-analysis with many different research studies being accessed to form a conclusion. This was helpful as an individual researching to learn about the different type of studies completed, and this study will ask if homelessness and substance use lead to a higher rate of suicide. So as far as the method goes, the participants included will be 100 people who are either currently homeless or have been homeless, looking for those who have and have not used substances. It will include participants over the age of 18 and exclude juveniles. They'll be selected and located at social service agencies, shelters, day centers, homeless camps, parks, soup kitchens, public places such as libraries, etc. Outreach teams who work with the population could also assist with finding participants for this study. And they'll be volunteers, and they'll be given $5 gift cards in exchange for their participation. They must have experience with being homeless for the study to be effective, and then they'll have to answer pre-screening questions before they participate. Instruments. The survey that will be conducted is a survey questionnaire that will contain demographic questions asking about the gender, age, race, education, and marital status. It will include a linear scale question from 0 to 10, include a Likert scale question, the semantic differential scale question, and then 2 open-ended questions asking them to describe any personal experiences of homelessness or substance use and being suicidal, and then, in their opinion, what are some of the barriers for homeless individuals who use substances, and how can the community improve mental health services for this population? The pre-screening questions will ask if they've experienced homelessness and if they've used substances while homeless, and then they'll proceed to the questionnaire. By studying the answers from the survey, we will be able to look at the study to see if there's a higher number suicidality rate with the co-occurrence by comparing with the people who did or did not use substances while homeless. So the procedure, the research study survey questionnaire will be conducted in person because some of the homeless individuals may not have access to the internet. It will be anonymous, no personal information attached to identify or incriminate them. The privacy is very important to collecting the data. Volunteers will assist with collecting the surveys, and convenient sampling will be used. We'll also use stratified sampling to distribute the survey results into groups. And before the participants begin the survey, they'll be informed there may be sensitive material involved, and there will be some therapist information available or mental health resources afterwards, information for the crisis center and a local treatment center if they need that afterwards. The design of the study is to look at the relationship between homelessness, substance use, and if the co-occurrence of the 2 elevates the risk of suicidality. The independent variable is substance use. The dependent variable is suicidality. A cross-sectional study will be utilized. This information is taken from the homeless population and results are examined at one time. The researchers will look at and compare the statistics for the individuals who have and have not used substances while being homeless and measure the results to see if the participants who use substances had a higher rate of suicidality. And it's expected that the outcome of the study will be that there's a positive relationship between homeless individuals who have used substances, and in this case, that if a homeless individual does use substances, the suicidality will increase. For the results of this survey, it's expected there will be a higher number of participants who have experienced feeling suicidal if they have used substances than if not. And because it often leads to guilt, shame, isolation, and withdrawal from relationships, this increases mental health symptoms, this increases suicidality. We'll assess the open-ended questions also looked for commonalities between the responses, and it's expected that the people who have answered yes to using substances while homeless, the responses on the semantic differential scale will lean towards the answers of negativity rather than the positive feelings. Some of the earlier research studies said that these results reveal some of the predictors associated with the increased risk of having alcohol and drug problems and suicidal tendencies. Thus, the results suggest that special effort should be taken to develop programs to meet the needs of those groups of homeless people. Also, the present study's findings highlight the urgent necessity to provide impactful and accessible suicidal interventions, as well as other mental health care services, along with the provision of stable accommodations like housing to homeless populations and mobile outreach teams, as well as public or community-based psychosocial programs can play a significant role in providing timely suicide-specific interventions for individuals experiencing homelessness. The purpose of this study was to look at and explore the relationship between substance use and homelessness, and if their co-occurrence leads to a higher rate of suicidality. The expected results were that there will be a higher rate of suicidality if the individual has experienced both homeless and substance use due to feelings of isolation, shame, guilt, withdrawal from society, and loss of relationships. This study will contribute to social work because it will address how to help better the homeless population who struggle with substance abuse and get feedback from people with lived experiences, which is critical in improving programs and processes in our society. Limitations that exist for this research study are that participants who are self-reporting will not give accurate answers due to fear that they'll face some type of legal involvement or charges if they disclose the information, or that they'd be admitted for psychiatric help if they admitted they're suicidal. Another limitation would be that there's not an accurate representation of all ages, sex, race, or ethnicity to gather accurate data, and the results might not be equal in all the participants. Sampling bias is another limitation, as it might be more difficult to locate the individuals who live away from social service agencies or in locations they don't often live. Therefore, the study would limit some of the population, and then also stigma or judgment is a limitation of the study, as they might not answer truthfully because they might be judged. Implications for this research study are things like improving access to services so that we can better understand how to help the homeless people who struggle with substance use. We can also use this data to improve policy and interventions in social work and better address the needs of the individuals with targeted interventions. We also, using this study, could enhance the support programs and raise awareness and advocacy around this subject, which is really difficult but necessary and important, and also be able to use it to collaborate with agencies in our society and our community to better be able to help these individuals out of feeling suicidal.